This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
Halloween. Kids dressing up as superheroes, monsters, ghosts, and goblins, going door to door for different fall-themed parties, collecting all kinds of delicious ooey-gooey candy. It's what most kids look forward to this time of year.
And I think it's safe to say parents enjoy seeing their kids have all the Halloween fun, but what parents don't look forward to is any cavities all that candy can create. However, according to Dr. Leigh Auchey of Delmarva Dental Services, there is a way to decrease the damage caused by sugary sweets.
Say hello to the season of sweets.
Halloween is definitely the beginning of the holidays, beginning of the snacking, beginning of the sweets.
And when it comes to your teeth, Dr. Leigh Auchey of Delmarva Dental Services says there are some sweets that are worse than others.
Most candy has sugar in it, but the sticky ones are the really bad ones for your teeth because they stick in the grooves of your teeth.
Candy that can circumvent the toothbrush.
Even when you brush, you may or may not necessarily be removing all of that, so it just lingers there, creating an environment that bacteria thrive on and begin to form cavities.
Dr. Auchey says your first line of defense can be something as simple as water.
Drinking water after you eat candy is going to help at least to rinse off the sugar and the byproducts of eating those candies.
She suggests taking a bottle of water along while trick-or-treating.
Brushing is also ideal. However, when you're out trick-or-treating and your kid is snacking a little bit because they're so excited they got this candy, you're probably not going to be able to do that. But if you do have water that you can just let them take a little swish, that's better than just allowing it to sit on the teeth.
Dr. Auchey says she lets her kids eat most of the sticky, sugary candy Halloween night.
Go for it. It's a one and done. You get to eat it, great. And then we sort of sort through everything. Keep out some of the foods more like chocolates, or there could be other snacks that you can even get for Halloween anymore that are not sugary. So those are fine. Keep them.
After the initial gorging, she has them rinse with water and then wait before they brush their teeth.
So let them rinse with water and then wait about 30 minutes before they brush so that they're not just brushing the sugar and acid right into the enamel, because that actually will wear down the teeth even faster.
Once Halloween is out of the way, it's time to strategize for the Christmas sugar rush.
So Christmas, you're going to have candy canes. That's a problem because you suck on the candy cane for a long period of time. And so that is just constantly bathing the teeth in sugar that is going to create cavities over time.
And the amount of sugary snacks seem to pop up everywhere.
They show up at your workplace, they're at the cookie exchange, they are at your holiday party. And so people are snacking more, and they are probably introducing more sugars into their diet than they would during a normal time.
Now, that doesn't mean you have to turn down delightful confectionaries.
It's just that you need to be aware of what you're doing and alter your own routine so that you're managing that so you don't have problems later.
No matter what time of the year it is, Dr. Auchey suggests being extra careful with the hard, sticky candy, especially if you've had dental work done in the past.
So a lot of times around the holidays, we will actually not necessarily see kids that have suddenly developed rampant decay, but it's parents that snuck a piece of candy and they pulled a crown off or broke a tooth eating something crunchy because they don't normally do it, and they just grabbed a piece because it looked good.
Sweets that can really sour any celebration.
And Dr. Auchey also reminds parents that it is vitally important to keep baby teeth healthy. Just because your child will eventually lose them doesn't mean that they won't affect the child's adult teeth that'll come in after them.
Really?
Yes.
I didn't realize that.
Very important.
Okay.